Just taking a look at the markets being down this morning, it might be in part because of these new lockdowns that Europe is kind of considering and actually taking into place in some of these countries. We spoke with someone in France earlier today who was describing how 50,000 cases a day is much bigger than it would be here because they've got maybe a fifth or a sixth of the population of what we have in the United States. So it's really got them in the throes of things right now. Is that where you think we're headed at this point?
I do, and you're seeing hospitalizations accelerate as well in Europe, so their healthcare systems are starting to get pressed. We're going to have a very dense epidemic, and I think we're at a tipping point right now, where if we took some aggressive targeted steps right now, we could potentially forestall the worst of it, but we're not going to do that, and I understand why. There's a lot of fatigue set in and a lot of policy resistance to taking strong action ahead of, the spread, and so we're likely to see a very dense epidemic. I think we're right now at the cusp of what's going to be exponential spread in parts of the country. You're starting to see certain states and cities react because the epidemics are more dense there. In Texas, you saw some action in El Paso. Utah's building field hospitals. Wisconsin's done that. So you are starting to see a reaction, but I think it's going to take more before we start to see broader-based policy changes that are going to ultimately turn the tide on the spread.
There was a huge political dust storm over the weekend when Mark Meadows said that we can't control this virus. There was pushback not only from Joe Biden, but also from some Republican senators as well. What is this in terms of linguistics? What can we do? What should we do? How would you describe and get in the middle of that fray?
Well, look, I think the experience in the South, the governors in the South arguably reacted late, but they ultimately took policy steps. They took targeted mitigation. You saw them closing bars, restaurants, congregate settings like that. They didn't have a broad-based stay-at-home order or shut down all business activity. You saw people pull back. Google mobility data really started to decline once the epidemic got dense, and then you started to see mask mandates get put in place, and adherence to masking started to increase. And that combined with a lot of spread in the South, so you did have a higher positivity rate and there was pretty diffuse spread, so the rate of transfer started to decline. That combination was enough to turn the tide in those epidemics. I think that there is a recipe where you can allow the economy to function, you allow businesses to stay open, but you take targeted mitigation steps to close certain venues or put in place curfews to close bars where you know there's going to be a lot of spread. You ask people to wear masks, and you can impose a mandate without imposing penalties, at least on a first offense. You can ask businesses to enforce mask requirements in indoor congregate settings. And then you appeal to the public to be more judicious about what they do. Instead of going shopping 3 times a week, you do it once. If you see mobility data start to decline, you know that's a pretty good indication that there's some change in behavior that's going to have an effect on continued spread. We have one more cycle to get through with this. I know people are exhausted. It's been very hard on families and on individuals, on businesses especially. But we really have 2 or 3 months of the acute phase of this pandemic to get through. This is going to be the hardest phase probably. So we need to try to pull together and see what we can do to try to control the spread so healthcare systems don't become overwhelmed. Because once they do, once we reach that breaking point, the policy action that we're going to need to take is going to be more aggressive, unfortunately, than if we had did some things up front.
Doctor, I have 2 questions for you. One relates to masks. The reporter that we were speaking to in France, in Paris, was saying that they have a mandate to wear masks, and yet the numbers continue to rise there. What do you ascribe that to?
Well, I don't know what their adherence looks like there. I know masks are debatable over in Europe, just like they've become a contentious issue here in the U.S. Remember, the masks are designed primarily to prevent people who are asymptomatic or pre-symptomatic from spreading the virus. So we know that if you have a mask on and you're contagious, but you don't know you're contagious, you don't yet have symptoms, you're less likely to dispel the kind of respiratory droplets that can cause other people around you to become infected. But the masks can also protect you. But in that case, if you want to derive protection from the masks, you need to be wearing a higher quality mask. Cloth masks are about 10 to 30% protective. If you're wearing a cotton mask, thickness matters, and cotton masks with polyester embedded in them are going to be more protective. Surgical masks, level 2 or level 3 procedure masks or surgical masks, are going to be about 60% protective. And then an N95 mask, depending on how well you're wearing it, is going to be 90% protective or better. So if you want to derive protection from other individuals, you need to wear a higher quality mask. It's a shame that we're at a point in this epidemic where we still don't have enough N95 masks to give them to high-risk individuals, people who are essential workers. But they are accessible in the consumer chain. They're just pricey.
Shepard Smith here. Thanks for watching CNBC on YouTube.